Heart disease is the #1 killer of men and women around the world. When most people have a heart attack, it seems to come as a surprise. Sometimes there are symptoms, but oftentimes a heart attack comes with no warning at all. New technology can help you stop this life-threatening event before it happens. Dr. Rajiv Agarwal is a cardiologist at Modern Heart and Vascular Institute. He is passionate about sharing how easy the screening is and what to do if you are a heartbeat away from a problem. Good morning, Dr. Agarwal.
Good morning, Deborah. How are you?
Good. All right. Let's get some kind of myths or misunderstandings out of the way. First of all, people will oftentimes say, oh, heart disease, that's a men's thing, isn't it? It's a woman's thing, too.
Oh, absolutely. It affects both genders pretty equally, and women have to be careful, especially around the menopausal years. And of course, later on, it's not a disease for only men. It affects both genders.
Yeah,
definitely.
I know a number of people who have actually had heart attacks, and they all said it took them by surprise. And we were surprised. Even people who seemed like they were very fit, they were not smokers. So there are not always symptoms present. But if there are some symptoms, what are they generally? And I know they can differ between men and women and individuals.
They do differ, but the most common symptoms, Deborah, would be if there's any discomfort on the chest, if there's any heaviness, pain, like a weight on their chest. And if it goes down the left arm, it's a little bit more concerned, shortness of breath. If you break out into a cold sweat for no reason, if you're nauseated. But the key thing is most heart disease symptoms happen with exertion. If you get chest discomfort when you're lying down or without physical activity, it's less likely, but it's with physical activity, it's way more likely to be heart related.
Yeah, and we know that a weaker heart or heart disease can come with age, it can come with obesity, but don't make the mistake of thinking that those are the only things that can cause a heart problem. You can be young and look like you're healthy and have a heart issue.
Absolutely. The key risk factors are, like you said, age, obesity, but let's not forget about the high blood pressure, the diabetes, the high cholesterol, stress. I mean, during this COVID times, we have so much stress for all of us, and we're seeing so many younger and younger people that are coming in with heart attacks to the hospitals that are stress related. And a lot of people have turned to smoking as well, unfortunately, and that is a key risk factor for heart disease.
Yeah, a lot of times what brings us in is a symptom that bothers us so much that it brings us in. You're saying don't even go that far. You can prevent this because you have that preventative technology. What are you talking about?
That's right, Deborah. We have a CT scanner that is a 128 slice CT scanner. What that does is in less than 1 to 2 seconds, Deborah, we're able to look inside the heart and see how much calcium buildup there is in the arteries of the heart. Literally, it takes 1 to 2 seconds. And the amazingness is that you find these blockages at such an early stage that you prevent. You find them early. You don't have to wait for them to progress, and then you're needing stents or bypass surgeries. We find them early, and then we can do some medications, lifestyle modifications to make sure that these blockages do not get worse. The key is prevention.
Yeah,
absolutely.
And I had this scan done, and I got to tell you, it just took a matter of seconds and gave such great peace of mind when you could look at all those things. You look at my heart, my lungs, and said, okay, you're good to go. So who should get screened?
The screening process really is for people, if they're diabetic or have family history, I would start at the age of 40. But with no risk factors or no symptoms, then 50 and above would be very, very reasonable. The statistics show that after the age of 50, people's risk of heart disease goes up significantly. But if they're diabetic or have family history, then 40 is very reasonable.
Yeah, it's interesting because we talked about, women also are at risk just as much as men. When you say breast cancer to women, we immediately, pay attention to that. But you say heart disease is more likely to be an issue.
Yes, and women forget, including my mom and my wife. They go for their mammograms regularly, but God forbid you ask them to come for heart screening. They forget that heart disease is 30 times more likely than breast cancer, causing morbidity and mortality for them. So yes, all women should be aggressively screened for heart disease. They're passionate about their breast health, and we are too, but we need them to be equally, if not more, passionate about their heart health.
Yeah, all right. Modern Heart and Vascular Institute, if you find blockage, then what's the next step?
Well, first step is that we talk with them. We see what risk factors they have and we try to modify their risk factors. Sometimes they need medications. For example, a lot of patients that do have cholesterol buildup, we put them on a cholesterol medication if they tolerate it. And we have a lot of options for people that are intolerant to the typical statin medications. And if we found their blockage at such a later stage where they're having symptoms and it needs to be fixed, then it gets fixed. But the goal of the technology is to prevent and find stuff early. And there are non-invasive, non-surgical ways to do that now, Deborah.
Yeah, all right. As I found out myself. Dr. Agarwal, thank you very much.
Thank you. Appreciate it.
Modern Heart and Vascular Institute is offering a free heart scan to the first 50 callers over the age of 65. To sign up, give them a call at this number. It's 832-644-8930. That's 832-644-8930. Or you can book your appointment online at modernheartandvascular.com. And of course, if you fall into any of those categories we mentioned earlier, you might want to get checked like I did. But to be clear, the special offer only applies to those over 65 years old.